Okay.
You are.
Now we're ready? Okay. It is 1:30. We will call the Cumberland County Finance meeting to order, and we will begin with a roll call, please.
Good afternoon, Commissioner Niebuhr.
I'm here.
Commissioner Fauci.
I'm here.
And Commissioner Eichelberger.
Present.
All right. Next stage on the agenda, we open up the floor to public comment. While we have a few folks in the room, I believe they all have a spot on our agenda. Is there anyone online interested in making public comment? If you are, please use the raise your hand feature and signify that you would like to make public comment. Audrey, do you see anyone online indicating that?
I see 5 individuals online, but no public comment at this time.
Hey, come on.
Okay, very good. Thank you. We'll move into the approval of the minutes of the March 5th meeting. Someone would make a motion?
I will move to approve.
Second.
It's moved and seconded. All in favor, say aye.
Aye.
Aye. All right. The best part of the agenda. We have some employee recognition here. First, Christine Hannock, who has been with our MH. Christine, have you been with MH the whole time for 25 years? Fantastic. She has been with the county and with the department for 25 years. And so we have a service award we'd like to present, and we have a supervisor here, I believe, as well. You ladies would like to come on up? This is Rebecca. Yes, Rebecca. I wasn't quite sure. I had a couple of names. Congratulations. Congratulations.
Thank you.
Yeah. So Rebecca, is there anything you'd like to say about Christine? Yeah.
This will be fast. So Christine, you've dedicated invaluable time and focus to the families you've worked with over the past 25 years. You've shown unwavering dedication to our department and, most importantly, to the families that we serve. Your tireless work in organizing and providing services has made profound impact on everyone. And it's not just about checking off tasks for you. It's about truly making a difference in the lives of the children and the families that you work with. Your hard work and passion and dedication have shaped the success of our department in ways that we cannot measure. You're not just a colleague, but you're a source of inspiration.
You getting us all choked up here. But that's so unbelievably fitting for the work that you do. You play such an important role in people's lives, and doing that for 25 years, the countless number of individuals you've helped. Thank you so much on behalf of the county and all of us here on the board. So we have a little recognition here, and we're going to get some staged photographs now. Everyone dry your eyes.
All right, everybody look here. I'm going to take a couple. Thanks.
That is like 20. Yeah.
Thank you.
Thank you.
All right. Next up on the agenda, we are having an update on the Connections Crisis Walk-in Center, and we are eager to hear this. So with us, we have Courtney Sanchez, Vice President of Business Development, and Kimberly Jones, Vice President of Clinical Operations. Thank you for joining us, ladies.
Thank you for having us for our first quarter update for the Emergency Behavioral Health Walk-in Center. Remembering that Connections' ultimate mission is to provide immediate care to people in crisis and then connect them to long-term support within their communities where they reside, which is the goal in our mission. So I just wanted to do a quick overview again of the service lines we're doing. So we are running 2 24-hour crisis mobile teams that serve Dauphin, Perry, and Cumberland counties. They're a licensed clinician and a peer in each vehicle. And they are dispatched 988, 911, and county crisis. Our walk-in center serves 14 and older, and it's 24/7 access to urgent care services for anybody experiencing what they define as a mental health crisis. With that, we also provide the further stabilization up to 23 hours and 59 minutes. Based on law enforcement drop-offs, parole, probation, we have two different entrances in that case. So people experiencing a mental health crisis coming into urgent care that needs further stabilization or can be admitted from urgent care into observation. And then we have the secured drop off at the back door for any of our law enforcement partners or first responders to be able to drop off in a secure way and be out back into their communities within under 10 minutes. So that's our 2359. If after 2359, again, the model is that we weren't able to stabilize, then we have worked diligently with the local inpatient facilities for that further stabilization, and they're taking direct admits from us. And there has not been barriers to that in the first 90 days. And then we do the follow-up with anybody discharging from our facility. We're making attempts at 24, 48, and 7 days. Follow-up calls, mobile calls for 3 days in a row with any encounter that they've had out in the community. And then documenting it in the EHR.
And I think it's important to note too, with the new 2025 SAMHSA national guidelines, they did a really good job in defining what a walk-in center means, because there's different levels of walk-in center. And so the walk-in center for Dauphin, Cumberland, and Perry operates under the high intensity model. And so that means that we are staffed 24/7, we are open 24/7, we serve voluntary and involuntary individuals with high acuity or low acuity, whatever that case is. And so it's that true no wrong door approach that we're able to preach and then serve the community under.
So as of this was through January.
Through January.
Through January 31st. So we've seen served 617 individuals. And we again, our average response time for mobile is sitting at 22 minutes. And we are able to resolve over 50% of the calls in mobile, stabilizing in the community, connecting them, and then they can stay in their environment, which is always the goal, is the least restrictive environment for the better outcomes for a patient. We've had really 50% of our drop-offs have been our law enforcement. We're working diligently with our law enforcement partners. 28% higher of drop-offs with our youth. And we're going to see that continue to move. In February, data will be out in the next by Monday, I think, or Friday, for February numbers.
So can I just back up and ask one question? No. You said this is through January. Does it include, which is some amazing numbers for it, but it is over 1 month, more than a month, right? Because it was December,
January.
It was December and January,
Yes.
right? So we have 2 months full. Were you open full of December?
No.
Okay.
Mobile launched December 4th. The clinic for adult launched December 11th.
Okay.
And then youth services launched January 13th.
Okay.
So we were fully operating all service lines January 13th.
January 13th. Okay,
Yeah.
great. Thank you.
Yeah.
I knew that there were phases, and I knew that it was
Yeah.
a little bit more than January, but I didn't know how much of December. Thank you.
And our data is always ready by the 15th of each month. So we caught this just a touch early to be able to give you the February numbers.
Yeah. I know that we're averaging 4 minutes for law enforcement drop-off time. So the time they ring our doorbell to us initiating custody and then back in their vehicles is averaging 4 minutes. There's always going to be an outlier because it just depends, but we track that on every single drop-off. And the average length of stay is 18 hours in our observation units, and that's a combination of both youth and adults. Like I said, we haven't had that people staying over outside of a transportation barrier, like they've been accepted at a facility, but then transport can't get there for this block of time, and we're scheduling those. So we do keep them to not disrupt their service and the continuity of care.
So in this next slide, we'll talk a little bit about stakeholder partnerships. And, as we continue to build and strengthen these services, our goal remains clear, is that we will, establish meaningful partnerships, enhance community awareness, and ensure that every individual in need knows that Connections is here to help. And so how are we working to make that impact? We're bringing this center to life, and that requires active engagement at multiple levels. Over the past few months, we've been intentional in our outreach, ensuring that stakeholders from first responders to hospital systems to everyday citizens all understand who to call and how to access our crisis services. And so the first pillar that you'll see here is the community outreach and awareness. Our recent virtual tour of our facility drew over 120 attendees. And so we feel that that demonstrates a strong interest and need for accessible services. And we are actively participating in some high visibility community engagement activities, and with two being the most recent that are coming up are the Perry County Health and Wellness Expo, and that's on April 1st, and the upcoming new Cumberland outreach event that's on March 15th. So those are exciting things that are coming up. And of course, we're actively deploying marketing materials to ensure the community understands that Connections is a comprehensive and easily accessible service. And so the next pillar that we have here is the law enforcement first responder collaboration. So when Kimberly talks about the 4-minute drop-off time, our goal was 10. That was our benchmark. And so we greatly exceeded that in these first few months. And I think that that's something to celebrate. That's something that we've communicated to the different townships and police departments. And so we recognize that law enforcement officers are often the first point of contact to individuals in crisis. And so to support them, we have completed briefings with multiple police departments that include West Shore Regional, Middlesex Township, Camp Hill PD, and Upper Allen Township. We have future briefings scheduled with Mechanicsburg PD because, again, we want to ensure that officers are aware of and equipped to direct individuals to the right level of care. And most importantly, we're really excited to announce that our mobile crisis units are staging at Cumberland Dispatch Center. And so that helps ensure a faster response time for 911 and 988 calls. And then our last pillar that we have here is healthcare and hospital partnerships. We are operating monthly hospital system meetings, and those are helping to foster seamless coordination between emergency departments and the Crisis Stabilization Center. We're working closely with inpatient hospitals, as Kimberly said, to ensure proper referrals and patient transitions. Again, the goal to reduce unnecessary hospitalizations and then ER time. And then we always have in our back pocket ad hoc reviews that can be conducted to allow us to respond quickly and efficiency to any urgent concerns or anything that may go awry. And so what does this mean for Dauphin, Cumberland, and Perry? What's the impact? These efforts are in motion every day. And we believe that by strengthening these partnerships across law enforcement, healthcare, the general public, schools, providers, community services, we are ensuring faster response times for those in crisis. We're diverting individuals from unnecessary hospital stays and incarceration, and we're providing immediate, effective, and compassionate care. And so this is the message that we want to convey loud and clear, is that Connections is here, we're serving crisis care, and we are ready to help. So if we're looking ahead, if we take a moment to pause and talk about what's to come, as we continue to provide services, we're looking at ways to refine and make things more seamless. And so Connections is working with Dr. Bledsoe to develop a work group focused on establishing clear criteria for an EMS pilot program. This initiative will be a critical step in ensuring that first responders have a streamlined process for connecting individuals in crisis to the right level of care. Once this work group is established, the next phase will focus on training and refining the process flow for the walk-in center, again, further enhancing that efficiency. from a funding perspective, everything remains on track and is progressing well. We continue to build Perform Care, and we are engaged in positive discussions with commercial insurance plans to recognize mental health parity and ensuring coverage of all services at the Stabilization Center. We're fully confident in the current funding model, and we expect to have grant funding fully expended by the revised deadline. So all good things to come and continued progress. Again, this is the first 90-day snapshot, and we have quite a few things up next on the docket. And now Kimberly will share an impact and success story that we recently received.
So we received this from a community therapist. I had referred one of my patients to crisis, and we utilized connections. I wanted to let you know how wonderful the experience was, not only for myself, but my patient and her family. We spoke with someone prior to her arriving, and they outlined the whole process, so my patient and her mother knew what to expect, and it was a smooth transition. Her mother texted me later that evening to let me know patient was staying for up to 23 hours. I had my follow-up session this week, and they had nothing but positives to say about their experience. By the time she left on Thursday, she had referrals to group and family therapy and was starting on medication for depression and anxiety. My patient reported she felt listened to and validated. She liked the quiet and calm atmosphere, and her mother was impressed with everything that was done with her in the time there. I also was happy that she was able to go there and not be subjected to a long wait in the ED, which could have been even more chaotic and traumatizing.
A good impact story.
Yeah.
I have to think that the ERs, when you're hosting your hospital meetings, are very positive about the role that you can play and thankful for the clinic. But I would also think that the law enforcement, with that time for them, that you're making that transition for them so easy. Have you gotten good feedback directly from them on that? Or?
Yeah, when I attend briefings, because I'm doing the briefings and I'm bringing my mobile manager with me, Tiara. And so that way she's out, her team is out in the community, and so interfacing with these officers. And they've been very impressed. My goal is to ask them to write like feedback, and good or bad. I always ask for the bad too, because there's going to be experiences that aren't that, that great, and then we work through those. So yes, the feedback overall is I just tried something new. That came from West Shore when I went to their briefing. I was just trying something new with a patient that we always run into, a familiar face, and decided to go to your back door prior to even me going to the briefing. So that's what kind of we hear, is that it's just different than what they've been used to. And so that I say that too, like, we're different, because it's a truly no wrong door. So.
Yeah, and it would be wonderful if you get feedback.
Okay.
That's great to hear. If you can share it with us.
Absolutely.
Via Annie or however you want to, get it to us. We have had people inquire and at different times about the services there.
Absolutely.
And the mobile unit being stationed out of our public safety,
Yes.
I know they were happy to be engaged with you
Yes.
in that process. So
Yes, absolutely.
your average response time will go down now. It won't be so far.
Right.
Well, that concludes our 90-day update. Again, thank you so much for your time.
Gary, you were taking
We
notes.
have
Do you have questions? Yeah, I was gonna say, do you have other questions? We're not letting you up yet.
Sure,
Do you have questions?
I don't have any questions. I know that in-house, I know that you have been used. I learned that in a meeting last week, and that experience was incredibly positive.
Oh,
That's
that
great.
makes my heart
That's great.
happy.
Yeah.
So.
So happy.
I don't know.
I will just add that one of the statistics that on the Medicaid side has been tracked since the pandemic was wait times in the emergency departments. And literally, that hospitals were very frustrated because we had people with behavioral health crisis needs literally for days, weeks, and we couldn't transition them. Well, that has all but stopped.
Good.
The last couple of months, I mean, our managed care partner started to say, are people forgetting to send this to us? And the answer was no, we didn't have any. That's great news.
That is great news.
Is that the case across the board?
That, at least for our 5 counties, that's been the case.
Very good.
Yeah. There's a Frank Campbell on my previous hand.
Okay,
Yes.
yes.
Commissioner
Yes,
Campbell.
Commissioner for Perry County, Mr. Campbell, Commissioner Campbell, would you like to make a comment or ask a question?
Sorry about that. I clicked the panelist thing there at the beginning of the meeting, but thank you for all your efforts down there. And for some reason, whenever your presentation started, my screen went blank. So if there would be a possibility, if you could forward your the slides or video to us.
Absolutely.
And Bill's in here with me. He was having audio trouble on his computer. So did you have anything?
You know, some days it all works well, and then Frank, sometimes it doesn't, right?
God, I can't believe it. The weather's so nice outside. Maybe it's saying you could be outside instead of inside. But in any event, thank you for all your efforts down there. We appreciate it. So
Thank you.
Thank you.
Thank you. Anyone else? Anything else, Annie, you wanted to add as far as does it feel like it's in a rhythm yet? Working?
We're gonna get there, you know,
Okay.
and one of the things that I know Dauphin County is seeing is actually a reduction in involuntary commitments using their crisis and an overall decrease. We haven't observed that yet here in Cumberland County. We believe that some of that is probably linked to what Courtney was talking about with the pilot for EMS, you know, because we really have no ability to get people across the river. So unless somebody is taken there, which has gotten to be a little bit just a barrier, you know, a problem that needs to be resolved. So we will continue to work on these things to try to maximize the use of the program.
Good. And recently we are meeting with some of our delegation, the senators that represent Cumberland County and Perry County and Dauphin County, I think in one instance. They would be more than willing if there's anything at a state level that needs addressed. I know much of it may be federal rules around Medicaid, but if there's anything at a state level, they would welcome being engaged around that. So
Absolutely. Yeah.
I think the key ingredient is long-term sustainable resources.
yeah, or being able to bill appropriately or those
Correct.
sorts of things. Yeah.
Here.
Okay. Ladies, thank you very much.
Thank you so much.
Appreciate it. All right, next up, Elizabeth Grant.
Good afternoon, commissioners.
Oh,
So we have 2 agenda items on your agenda for today related to a bid opening. This is for a project for stream crossings and fencing that was identified as part of our National Fish and Wildlife Foundation project. It is a preserved farm owner. The address is 44 Ponderosa Road in Lower Frankfort Township, and it is a pasture-raised cattle operation. So we did have a bid opening for this project, which is a collaboration between Planning Department, National Fish and Wildlife Funds, the Countywide Action Planning Funds, and also the Conservation District. The bid opening was held on March 7th. We did receive 2 bid respondents. However, only one of the 2 bids was determined to be complete and qualified. So that is the bid from Capital View Excavating and Paving for the amount of $129,238, which falls well within the engineer's cost estimate between $120,000 and $150,000. So those were the results received. We are seeking a motion of intent to award and then an award for this project to Capital View Excavating and Paving. You'll notice that this is phase 1. There will be a second phase to this improvement project. We are breaking it out in phases due to the constraints of our funding and the term of the funding.
Sounds good. Does anyone have any questions of Elizabeth at this time?
I do not.
It's the only thing I would say. This is phase one. When would you anticipate phase two?
Phase two, our engineer and our conservation district are working together on that phase. I do believe it will be issued later this summer.
Okay,
Yeah.
so it will
Like
be
it-
within this calendar
it will
year?
Likely
Okay,
be within the calendar year. Yes.
okay. Any other questions? All right, entertain a motion if someone would like to make that.
I will move to issue notice of intent to award, and then award the phase one voice fencing and stream crossing project in the amount of $129,238 to Capital View Excavating and Painting, subject to solicitor and Cumberland County Conservation District and Planning Department approval.
Well, second.
It's moved and seconded. All in favor, say aye.
Aye.
Aye. Thank you. All right. Next up, we have a discussion and potential approval for a resolution.
Hi, Commissioners. Okay, so in 2002, Resolution 2002-39 established the rules and regulations surrounding collection of county taxes by tax collectors and how payment was sent and when it was to be sent to the county. Obviously, there have been a number of years between 2002 and now, and if you recall, just about a month ago when the tax collectors were here, they mentioned some dissatisfaction with that. So I got to look at my cheat sheet and make sure I don't miss anybody. So Ron Snow, Kathy Waters, Mel Mikesell, and Robin Weigel and I attended the last tax collectors meeting, and we fielded what their concerns were, what changes they'd like to see, with the intention that the internal working group, which is everybody I just mentioned, along with Dana Best, the CFO, would review it to make sure that there weren't any negative impacts to the county if we made the changes. And the team reviewed their recommendation or their request, which was they had were required to do weekly payments between November 15th and the end of the year, which became very disruptive because up through starting on December 14th, there's no more personal checks. But prior to that, people could write personal checks. And so they were having a very difficult time getting their accounts to balance because they would have to submit payment very soon after they had received a bad check. And that happens earlier in the year, it all washes itself out. They're able to send less money the next time they make payment. Can't really do that the last 2 weeks of the year. So that was very, very difficult. So they asked for that period of time, November 15th to December 31st, or really until settlement date, which is January 15th, to be biweekly, just like the remainder of that period. And they also were hoping for some additional time to make the payment. So currently, the way Resolution 2002-39 reads, they collect in a 1 week or 2 week period. By the following Wednesday was the date that they were to making payments to the county, with a 2-day grace period through that same Friday. They requested just make it the following week. And the impact of that is negligible because essentially what that means is rather than today, so I had to think about the date, rather than today being the first due date, it would be next week. And so really it just offsets the payments by 1 week, but the remaining, except for that November 15th to the end of the year, the remaining schedule would then be the same. So those are the major changes you see in the resolution before you, which is 2025-5. Do you have any questions for me?
I don't have any questions, Stacy, but I wanted to thank you and thank the team for putting the effort into this. I know that the whole process of the engaging with the tax collectors at times was frustrating to me. But I think at the end, we ended up in a really good spot in being able to evaluate just a really old, outdated document that wasn't revisited for too long of a period of time, which we know won't happen again now that we're addressing that. But and remedy some things that just made everyone's work environment go more smoothly. And it wouldn't have happened without your guidance. So thank you
Thank
very
you.
much for doing that.
They were delightful. They were delightful to work with. And once they said what they wanted changed, it was like, that's easy. It's definitely a win-win. Win-win for them. We're all.
Love it when that happens. So, are there any other questions? Are there any questions of Stacy? I should say?
There is one thing, I'm sorry, I'm a detail-oriented person, I apologize. The one thing that, so, you know, they had a 2-day grace period, which I believe I mentioned. What we did is we flipped that around so that the due date is always on the Friday. And if they want to mail it, it must be postmarked by the Wednesday. And our solicitor, who I really love the way he words these documents, he did include in there throughout the document an explanation. What do you do if the due date is a holiday? What do you do if you have to pay something by the 10th of the month and that is a holiday or a weekend, which just provides so much better guidance, I think, to the tax collectors at the end of the day and our internal staff as well. So, sorry. Now I'm done talking.
Very good. And as there have been some new tax collectors and we have some that are retiring after a very long tenure. I think it's good for the clarity for them especially. So thank you very much. If there's no other discussion, I'll entertain a motion for approval.
I'll move for approval.
I'll second. It's moved and seconded. All in favor say aye.
Aye.
Aye. Very good. Thank you. Thanks. Is there any other business to come before the board at this time?
No,
Doesn't seem like it.
I'll move to adjourn.
Okay, we so moved.